This is a hint from Howard on restorative basics. Know and understand the products you are using. This is Dr. Howard Strassler. So think about it. The instructions for use on the products and devices we're using, that it's mandatory. It's required that you train all your staff. It's important that they know uh, similar things about the products and how they use them that you know as the clinician. And let's face it, the new products that we get into our office, there may be changes in names and formulations, but we're using them the same name. And we're talking about training not just for yourself, reading the instructions when you get a new product that you've never used before, or learning how to use a new device, but also the associates in your office, the new dentists. These new dentists may not have learned with that product. They may be generalizing to the products that they're using that all PVS impression materials are the same. All adhesives are the same. All composites are the same. The curing light they're using is exactly the same, when in fact that's not the case. And your chairside assistant, an important part of that training, and a new assistant that comes in the office need to become familiar with those instructions for use for all the restorative materials you're using, for all the products you're using, and certainly the dental hygienists also have to be aware of those products that you're using. And it would be nice if there was an app on our phone, on our devices, that would give us the instructions for use as sort of ways for the materials for the devices we're using. You pick up the phone, you hit an app, and lo and behold, when you punch in the name, it pops up. Well, unfortunately, that's not the case. Uh, Now, instructions with graphics that come with our products are close. We need to keep the sheets, but they're not the end-all be-all because, as you can see with this graphic on the left, figure 1, while it's telling us to do something to the dentin, what are we using to do that with the dentin? And that parallels the instruction sheet that comes with the product. And then the product names can be consistent, not consistent and confusing. Uh, you've one product that's called a cavity cleanser, another one that's called a cavity conditioner, and then another product that's called a tooth conditioner. And all three of these products are significantly different and have different uses. In fact, a cavity cleanser, a 2% chlorhexidine digluconate, is placed on the dentin for 60 seconds after etching to stabilize a dentin bond with fourth and fifth generation adhesives. A cavity conditioner, aka a dentin conditioner, is a dentin treatment for glass ionomer cements, usually 10 seconds. Rinse and dry. It's not an etchant, it's a cleaner, and it's a 10% polyacrylic acid. And then Dentsply caulk has a tooth conditioner that in fact is a phosphoric acid etchant used for etching the enamel and dentin with anyone's adhesive. So those names can be very confusing, and they're not consistent, product to product, manufacturer to manufacturer, brand to brand. In fact, these are etchants that have brand names, but what is their description? Ultra etch, phosphoric acid etchant, universal etchant from 3M, SB, that 34% tooth conditioner from Dentsply, caulk, which is a phosphoric acid, a gel etchant from Kerr, Onyx from Centrix, Total Etch. All of these are etchants that are used to etch enamel, etch dentin, not to be used with glass ionomers. And then our resin bonding adhesive, which is which? Are you using a fourth generation, a fifth generation, a sixth generation, or a seventh or eighth generation? Are you using a total etch technique, an etch and rinse technique, a self-etch technique? Are you using a universal adhesive or using it in a dual cure format It's different from product to product. You need to look at the instruction sheets and match up the technique with the material you're using, whether it be a light cure composite resin, whether it be a dual cure composite resin core, uh, whether it be a composite resin dual cure cement, or a self cure cement. You need to understand and know these products. In fact, it is confusing. On the left-hand side, Optibond Solo Plus is a total etch dental adhesive. Total etch refers to the fact that you have to use a phosphoric acid etchant with it. Although if you were to ask some dentists and you would say total etch, they would think that that's a self etch because it means it's doing everything completely. And there are different products in different countries with different names. So 3M single bond universal adhesive in Germany is exactly the same as Scotch Bond universal adhesive in the United States. In fact, in the United States, single bond refers to an etch and rinse 5th generation adhesive resin. Adhesive from Ivoclar is a self-etch product. Prime and Bond NT is a 4th generation product, and by the way, it also has a self-cure component. And so we can use Prime and Bond NT with the self-cure component for dual cure composite core materials. But can you use it with the composite core you're using that isn't a Dentsply product? And when you read the instructions, there's variation from product to product. For Prime and Bond NT, we allow the adhesive to sit and remain fully wet for 20 seconds. Yet for Optibond Solo Plus, they're telling us to do it for 15 seconds and to use a light brushing motion. And so from product to product, the manufacturers are telling us to use them following their instructions. So we need to know those instructions. And in fact, when adhesives are used with resin cements and dual cure composite cores, as I mentioned earlier, they require activators that are product specific. Prime and Bond NT can be used as a 4th generation direct placement adhesive, but when we add a drop of their self-cure activator to a drop of the Prime and Bond NT, we now make it dual cure for use with a dual cure core material, Fluorocore 2 Plus from Dentsply, or for Scotch Bond Universal Adhesive, they have a Scotch Bond dual cure activator as well. And some will ask you to light cure it. Some will say don't light cure it. So you need to know those indications. In fact, for the 3M Scotch Bond Universal Adhesive and our placement, when we use it as a dual cure, we mix it 1:1, so we can see in the middle. We rub it on all the dentin for a crown preparation for 20 seconds. And then we air evaporate it off. And whether we light cure it or not depends upon the cement we're using. And then if you're using a plastic disposable tray, whether they be perforated or solid, we're typically using a tray adhesive on it. Whether it be a vinyl polysiloxane or a polyether or an alginate, is the labeling clear? And you can see on the left-hand side, VPS is listed on the Kerr box. VPS is listed on the 3M box. These are meant to be used only with vinyl polysiloxane impression materials. But caulk's tray adhesive, what do we use it for? Well, that's also a VPS adhesive, but it only says tray adhesive on the bottom. And then if you have 3M products in your office and you happen to have a polyether, you use a specific adhesive for a polyether that doesn't work with a VPS. And so knowing the tray adhesive and then reading. The virtual tray adhesive from Ivoclar is for silicone impression materials. And silicone means VPS or vinyl polysiloxane, or PVS, same thing, polyvinyl siloxane, or there are other silicone impression materials, but not for a polyether, not for a rubber base. And then if you're using alginate, you're using special adhesives for alginate that are either paint on or spray on, but those are not meant to be used with vinyl polysiloxane or polyether, strictly for alginate impression materials. And then the instructions for use for the adhesives, how long do you wait? Well, on some of the instructions it says wait approximately 3 minutes or blow dry with compressed air. But you must replace the bottle cap immediately. For Express, the impression material from 3M, they say 5 minutes. For others, it may say leave it on to work for 3 minutes. They don't say anything about blowing it dry. And in fact, replacing the bottle cap is key because for all these tray adhesives, you don't want to let the solvent evaporate. Because as the solvent evaporates, the adhesive gets thicker, it's not going to work as well. So know these instructions, how long to wait to make sure you cap them off. And the same is true of your composite resin, your bonding adhesives. If you're using a bottle, make sure they're screwed shut. And then again, is 3 minutes enough? Did the manufacturers come up with a number that would be short enough that we would not be bothered by it? And keep in mind, for most of our trays, who's painting the trays? Our assistant is, our chairside assistant. In fact, we'll try the tray in, our assistant will place it and paint it, and then we'll get to it. And fortunately, in many cases, we're doing the tray try-in before we're doing our preparations and setting it aside. But some of the research shows that there are some significant differences in the time. In fact, in the top study, drying time of tray adhesive, they say wait until 10 or 15 minutes. And that using the same adhesive from the same company gave higher strengths. In the Journal of Prosthetic Dentistry, the effect of different adhesive on vinyl polysiloxane bond strength to two tray materials, that the conclusion was GC and Kerr tray adhesive performed the best with 10 minutes. After 30 minutes and you haven't made the impression, they're recommending reapply. And so if you're painting the adhesive on at the start of the visit, but you're not getting to the impression for 45 minutes an hour, you need to reapply it. And these are just two of a number of different studies that are in the literature. So the bottom line is revisit the instruction sheets, follow the manufacturer's directions, and remember, the magic is not in the tools, it's not in the materials, the magic is in you, knowing how to use these materials and using them correctly. This was Dr. Howard Strassler with a hints from Howard on restorative basics, knowing and understanding the products you're using.